So when we talk about what a co-occurring disorder is, we're referring to both a substance use and mental health disorder, and importantly, one or more disorders relating to the use of alcohol or other drugs, and one or more mental health disorders. It has to be a disorder of each type that can be established independently of each other. It's not simply a cluster of symptoms resulting from one disorder. What do I mean by that? It's not simply a cluster of symptoms resulting from one disorder. We have to have two independent diagnoses. Someone give me an example of a cluster of symptoms resulting from one disorder.
From substance use. So if someone is diagnosed with polysubstance abuse, and also so they have symptoms of depression, symptoms of anxiety, maybe some psychotic symptoms. So you need to first rule out that those symptoms are not a cause of the drug and alcohol use.
Exactly. Thank you. How many of you guys have seen clients that look psychotic, and then probably once they've stopped using their methamphetamine, suddenly their mental health symptoms remit? Turns out they might just be a big old drug addict, but they don't actually have an independent mental health diagnosis. Importantly, clinicians' knowledge of both mental health and substance abuse is essential but challenging to achieve. Most of the time, our training is pretty specific. People often enter the field through an addiction door. Maybe they are in recovery themselves. They have an interest in addiction, and they develop skills and get trained in that area. And then people also take a mental health path. Very infrequently is there a lot of addiction training within mental health programs and graduate programs. So what happens often is that there's not a lot of overlap, and people typically aren't well skilled in understanding both disorders. So the question is all this well and good, but is dealing with drug abuse really important to my job? So let's kind of look at just some of the prevalence data. In 2006, which is when we have the most recent data, we know that there were about 5.5 million adults that met criteria for both a mental health disorder and substance dependence. And in 2006, we had almost 16 million adults had at least one major depressive episode in the past year. The rule that you see over and over again is almost this sort of 2-to-1 rule. Adults with mental health issues are typically about twice as likely to actually be using substances. In the past year, they were more likely than those without to have used an illicit drug in the past year. We see this with both alcohol and drugs, that these co-occur frequently. When we look at where these people, here's these 5.6 million adults with a co-occurring disorder in the last year. If we look at where they received treatment, in 2006, where did most of them get treatment?
Nowhere.
Nowhere. About half of the folks don't get treatment. If they are getting treatment, where are they coming? Treatment for their mental health. And really, this is the slice that is going for their addiction. And here is people entering programs that address both their mental health and addiction. So people are more likely to come to your door. So in addition to being the jack of all trades that you already are, now you have a group of people who are primarily seeking assistance from you, even though they have multiple disorders. And when we look at alcohol, we see a pretty similar pattern. The no treatment slice goes down, which is good. It means that people seem to be getting treatment for alcohol more than they are their substances. Again, they're coming to you first. They're coming through the mental health door. A much smaller number are actually going to programs that deal with dual diagnosis.
But overall, if you look at those people who are getting treatment for both or treatment only for alcohol, it's about 11%. And on the previous slide, it's about 11%. So while the number not getting treated at all goes down, where they're going is to you guys to get their treatment. They're going into the mental health system, not into the addiction treatment system.
Exactly. Thank you, Tom. This is back to this same sort of 2-to-1 that we see. If we look in the past year at those who used illegal drugs, about twice as many had a major depressive episode than did not. So we typically see that if you have a mental health issue, you are disproportionately likely to be using substances. And this holds true for adolescents. These are folks who are aged 12 to 17, and we see generally the same pattern. Now we're going to look at your county. So I think this is really impressive. In 2007, you guys saw almost 62,000 people through your system. I think that is so impressive. I mean, it's a huge number. There are states that don't see anywhere near that number of people through their system. LA County has incredible access and a large population in need. And this is just in your directly operated programs, folks. This doesn't include contracted providers. So you can imagine how high that number actually is. Right here, 44,000 of those, which is about 71%, this is where the dual field was coded properly. So what we see is that of those folks who were where the dual field was coded properly, we see that about 71% indicated no substance abuse, and in about 29% of the cases, substance abuse issues were noted. So what this is telling us is that at our very worst case, best case scenario, 29% of our clients have some sort of dual diagnosis. Mind you, 29% of the folks were not coded properly, so we didn't even get information or good, accurate information on their use. So in almost a third of the cases, the forms aren't being done probably properly, or at least a really good assessment isn't being done for these folks. In the cases where it is being done, again, just happens to be 29%. There are substance use disorders. How about folks here? What percentage would you say of your clients have a co-occurring disorder? Do you think it's higher than 29% or lower?
Higher.
Much higher. That's typically the response we get, that 29% actually seems pretty low. And one of the goals of the Department of Mental Health is to try to reduce this number of the incorrect or where the dual code field was empty. We want to lower that number. We want people to do better screening and assessment in the system. And when it does happen, we probably will get a more accurate reflection of how many people actually have both mental health and substance use disorders in the system. But at the very least, 1 of every 3 people who walk through your door have these extra needs. So we know that co-occurring disorders are common in the general adult population, and there's some indication that there's an increased prevalence of people with co-occurring disorders. Several of you mentioned the additional complexities that they bring to your workload. We know that they're also more likely to be hospitalized, and that the rates of mental health disorders increases as the number of substance use disorders increases. So what we see is as the number of drugs that one is using increases, the number of mental health issues they struggle with increases. And you can also say, as people's mental health issues and number of diagnoses increase, as does their use of different substances. So these things go hand in hand. And really the goal for today is to talk about how, if we treat substance use disorders, we are addressing mental health. We are addressing mental health symptoms by treating the substance use disorder. Very often there's this frustration about what do I treat first, what do I do with people who have substance use disorders, and it's part of what we're going to address today.